Welcome to the top 10 most important muscles every snowboarder should be strengthening. Snowboarding's hard, like really hard. So when I thought about making this video, I realized that this can get very boring very quickly. So without getting too nerdy and scientific, I created my top 10 most utilized muscles, muscles that would be most important for you to focus on without getting in the weeds, so to speak. I am of the belief that knowledge is power, so I want you to utilize this video in a way that will benefit your training. Before we get started, my name is Mark. I am a doctor of physical therapy based out of Bend, Oregon. I am one half of Mobility Duo with my wife, Sarah, who is a yoga instructor, personal trainer, massage therapist, and we work primarily with snowboard athletes of various skill levels on strengthening, mobility, flexibility, and overall injury prevention. As always, we very much appreciate any likes, subscriptions, as it helps us out tremendously to put out and continuously put out amazing content for you. We created Shred 3.0, the most comprehensive snowboard training program for in-season or off-season. Check it out in the link in the description below. So one more thing before we jump into this, I just want to go over a few terms just so they're not going over your head in case you don't understand what they mean. First of all, flexion. Flexion can happen from multiple joints, but essentially you are just bending from the waist, you're bending at the knee. Extension, you're just straightening your leg or your hip back out. Plantar flexion, you are stepping up onto your toes, you're pushing the pedal to the metal. Dorsiflexion, you're bringing your toes up towards your leg. Internal rotation, just like it sounds, you're moving a extremity internally towards each other. External is the same idea, you're moving it away from you. Abduction, you're moving it away from you, away from your body. Adduction, ADD, you're moving it towards. There is no order from 1 to 10 with these. They are all important in my eyes. They all provide a different function while you are snowboarding. But for the sake of ease, we're gonna start from the bottom and move our way upwards. Now that we have that out of the way, let's jump in. First muscle is going to be the tibialis anterior. You'll hear about this muscle quite often, but we can think of the tibialis anterior as being a primary dorsiflexor, so bringing that foot up towards you. So whenever you're going heel side, whenever you need to make adjustments, it is also primary inverter, so bringing that foot in. Same thing, we often shift our weight toe side, heel side, laterally, medially. So it's going to be a primary mover in that realm. All right, muscle number 2, moving to the outside of the bottom of that leg. We have 2 of these, but I put them in one, the peroneus longus and brevis. And essentially these are those muscles on the outside of your leg. These are primarily everters, or moving your foot outwards away from you. And I often hear about these being cramped, being on fire, being uncomfortable, or being in pain because one, the boot can often cut off blood supply or nerve supply, and many of you or us can be stuck in one position, whether heel side or toe side, stuck in that everted kind of motion. So again, this is primarily an everter, so moving that foot out, often used for making those minor adjustments on the board. Third muscle is the soleus. That's right, I said soleus, not the gastroc. So soleus sits underneath the gastroc. Gastroc are those 2 muscle bellies that you see in your calf. This one sits underneath. This one is primarily a plantar flexor, so pushing down that pedal to the metal, especially in a knee flexed position. So remember what I said, flexed, we have that knee bent. So, like it sounds, we're stuck in a squat position while we're snowboarding. That soleus is responsible for that toe side or even controlling that extension coming back up. So it's very, very important. It's very powerful, and you're seeing a lot more studies on why it's so important. Muscle number 4, coincidentally, I have the quads, but out of the quads are those muscles in the front of your legs, the ones that always get tired in the squat position. We have the rec fem or rectus femoris, and this is important out of those 4 because it crosses both joints, the hip and the knee. So it primarily extends the knee, but it also controls the ability to come down to that squat position. This also turns into that tendon that covers your kneecap. So this is very, very important. It is a primary knee extender as well. It crosses the hip and helps it flex. Number 5, we have glute med or gluteus medius. Now there are 3 main glute muscles. This is one of them. You often hear about it, and it's very, very important, especially for keeping the pelvis stable. So rarely are we weight shifted evenly. We're usually on one leg or the other, whether we're trying to keep our nose up, we're bombing down a hill, but essentially it'll keep that pelvis stable. Gluteus medius is very important because it is an internal and external rotator of the femur, as well as a primary abductor. Remember, we're moving that muscle or that femur away from the body. So it's very important and often very weak, especially on men. So it's almost very vital that we not necessarily isolate to strengthen it, but incorporate it in our normal day-to-day strengthening routines. Number 6, we have gluteus maximus. Yes, the peaches, the main squeeze, the muscle that many of us overemphasize and is just very, very powerful. This is one of the strongest muscles in the human body. It is a primary extensor and external rotator of the hips or the femur. Extremely important, especially with that extension or standing up and controlling that ability to come down into a squat position. If you have weak glutes, which again many of us do, many other muscles will compensate, will get fatigued. So it is very, very important that we know how to activate these properly, especially individually if we need to, because again, rarely do we evenly distribute that weight side to side. Moving back to the front, muscles number 7, we have rectus abdominis. Yes, this is the 6-pack abs. As straightforward as it sounds, it is extremely important because our core is involved in almost every aspect of snowboarding. If you have a weak core, you're going to have a weak day. Every strong snowboarder is going to have an extremely powerful core. Regardless if they isolate, strengthen it by itself, they will work it through being on the slope. So rectus abdominis is a primary flexor of our torso. It connects to our pelvis, so it also stabilizes our pelvis as well, or the bone, I guess, that surrounds your hips. That's the pelvis. Extremely important. Muscle number 8. So we have the obliques, internal and external obliques. Yes, there are 2 parts. Now, not only do these help and guide in rotation, they are not the only ones, but they are primary rotators of our torso. They also help our diaphragm. They help us breathe. All right, so the obliques are extremely important. There are 2 different types, and the muscle fibers work in different directions to allow us to rotate properly or move in a diagonal manner. Number 9, we have some muscles that maybe some of you have never heard of, and these are the erector spinae. These are essentially supporting muscles of the spine, but you have a few different muscle bellies along the back. They work concurrently with the glutes to help posture, to help keep you upright, to help rotate, to help extend, etc., etc. Many times these can be extremely weak, especially with those who have low back pain, but these can also be extremely overdeveloped, especially for those like bodybuilders who tend to focus on those posterior back muscles. Regardless, these are extremely important for snowboarding because of that posture, because of the ability to correct that posture, knowing where your body is in space, keeping that upper and lower, upper extremity, lower extremities connected, and also being able to separate those when you need to adjust for terrain, to adjust in the air, etc., etc. Last but not least, number 10. And this is actually a group of muscles, so this is actually 4 muscles, but it's your rotator cuff muscles. Now, why am I saying rotator cuff muscles? Because the number 1 injury in snowboarding is upper extremity. Wrist, elbow, shoulder, clavicle. By far, happens all the time from that foosh mechanism falling on an outstretched hand. So rotator cuff muscles, if you didn't know, are made up of 4 muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. Okay, so these all surround the shoulder capsule to guide it, to be able to support it, keep it snug in that joint, but also move it in different directions. Supraspinatus, again, is that abduction, moving that arm away. The teres minor and the infraspinatus are external rotators, that ability to move back. So often you'll see these torn because of that arm being ripped back. And then the subscap sits behind just like it sounds, the scapula, and it's a primary internal rotator of that arm. These are all extremely important for strength in that shoulder, not only to protect our shoulders because they're very vulnerable because they move in so many different ways, but to protect you from a fall. It's essentially what they're there for, and to guide in that rotation that we've already discussed. By no means are these all of the muscles. I could name a dozen more, but I think you'd get bored. And essentially I wanted to come up with this combination of 10 muscles that you can really focus on. Essentially you can utilize these muscles, you can research them yourselves, you can find specific exercises if you want, or you can check out our Shred 3.0 program that covers all of these. I hope this was helpful. Thank you so much for joining me, and I will see you all next time.